Imagine this for a second. A surgeon is performing a really complex operation, but their hands never actually touch the patient. Nope. Instead, they're sitting across the room at a console, controlling these tiny robotic arms with a kind of precision that's, well, almost superhuman. This isn't a movie. This is happening right now. So how on earth does it work? And you don't have to take my word for it. Let's hear it straight from the surgeon we're following, Dr. Tarun Raju. His words really paint the picture perfectly.
You're not leaning over the patient, you are operating remotely.
So naturally, this brings up a couple of massive questions. First, how is this even possible? And maybe more importantly, is it actually a better way to do surgery? Well, we're gonna answer both of those by taking you right inside a real robotic hernia repair. Okay, so before we get into the cool tech, we gotta understand the why. This incredible technology didn't just appear out of nowhere. It was designed to solve a very real, very human medical problem. Now, the patient in our case study was dealing with what's called an inguinal hernia. So what is that? Well, you can basically think of it as a bulge that happens when tissue from the inside, like part of the intestine, pushes its way through a weak spot in your abdominal wall. And get this wasn't just one simple hernia. The surgeon had to fix two separate ones on opposite sides of the body, and they were even different types and sizes. This is exactly the kind of complex job that really calls for an incredibly precise approach. All right, we know the problem. Now for the really cool part. Let's step inside the OR and see how the surgeon actually uses this robot to get the job done. You know, the whole complex operation really boils down to 5 main steps. They start by making these tiny incisions for the tools to go in. Then they have to create a workspace inside. After that, they push the tissue back where it belongs, reinforce the weak spot with a special mesh, and finally, stitch everything up. That's the basic roadmap for what those robotic arms are about to do. So, here's the million-dollar question. It's not just what they're doing, it's how they're doing it. What makes doing this with a robot so different? How is it a leap forward from what came before? And this is really where the magic happens. When you compare it to the standard minimally invasive surgery, laparoscopy, the robot brings 3 huge, game-changing upgrades to the table. First, you go from 2D to an immersive 3D vision. Second, you swap out rigid, straight sticks for instruments that move just like a human wrist. And third, the surgeon, not an assistant, is in total control of the camera. Let's start with that 3D vision because it's just mind-blowing. The surgeon literally described it as feeling like you've been shrunk down and placed right inside the patient's body. I mean, that's a level of immersion you just can't get from staring at a flat 2D screen. And it's not just 3D. We're talking about a view that's magnified 10 times over. Think about that. The level of detail is so fine that you can actually see individual tiny nerve branches. It's just incredible. Okay, so that's vision. What about the feel, the dexterity? Well, the surgeon's own words really paint the best picture here. He said it's just like being able to put your own wrist directly inside that tiny space you're working in. That's the kind of freedom we're talking about. So what does that actually mean in practice? Well, it means the tips of the instruments can rotate a full 360 degrees, way more than a human wrist ever could. It means the system filters out any tiny natural tremor in the surgeon's hands, making every movement perfectly steady. This allows for just an unbelievable level of precision, which is absolutely critical for delicate stuff like suturing. But, you know, it's not all sunshine and roses. A massive leap in technology like this always comes with some real-world speed bumps. To get the whole story, we have to look at the hurdles that come with a system this advanced. And yeah, these challenges are pretty significant. First off, the price tag is just enormous. These robotic systems are a massive investment. Then you've got the human side of things. There's a steep and pretty lengthy learning curve for surgeons to really master this new way of working. And finally, there's the clock. The whole setup process, which they call docking the robot, can actually make surgeries take longer, at least at first. So when you weigh the incredible pros against the very real cons, what does this tell us about the future of the operating room? Is this robot the new gold standard? And this might be the single most important thing to get about all of this. This isn't about robots replacing surgeons, not at all. It's about creating a better tool. It's a platform that takes a surgeon's skill and training and just enhances it with better vision, better dexterity, and better control. To really get it, you kind of have to look at the big picture, the whole evolution of surgery. For decades, the trend has been moving from big, open cuts towards smaller and smaller incisions. Robotic surgery isn't some brand new idea. It's the next logical step on that path. It's an enhanced, minimally invasive approach. And we gotta be honest here. From the patient's point of view, we're talking less pain, faster recovery. The benefits are often pretty similar to what was already possible with top-tier laparoscopic surgery. The real revolution, the big leap, is for the surgeon, which, of course, can then lead to even better results in the most difficult cases. And that really leaves us with this incredible thought to chew on. We've just seen how robotics can give a surgeon what amounts to superhuman precision. So as this tech gets better, smaller, and cheaper, you have to wonder, where else is this human-machine partnership going to show up? What other part of our world is about to be completely transformed?